All right, Matthew, we are live.
Hey guys, Matthew here. We are with our patient 1 day post-op of her procedure. If you look here, this is her before. Her main complaint was really the laxity here, and there's a little bit of excess fat. The buttock obviously needed a little bit more definition. She had some cellulite in certain areas, those indentations that you see there. This is her after. She also did a procedure on her arm, so the high definition liposuction was really done all throughout her torso and her arms. And if you take a look here, you can't really see it, but that's her incision, you guys. This is 1 day post-op. This is her incision. She did a spiral lift here. Additionally, she did fat transfer to the buttock. We did Selfina. If you look a little closely, there's a little ring here. That's where the procedure was specifically done to this area. And we add Sculptra. Sculptra is a collagen modulator, which helps improve the volume here with natural collagen that gets built by your own body. That'll take time to really show the results, but the Selfina also releases the tissue you see here, and now you see here it's improved. And yeah, if you get another angle, you'll see more of that here. But anyways, the spiral lift has really given her more of a definition here in her legs and her thighs. Now her second surgery, which will be in just a few days, she's gonna end up doing the rest of her body, so tummy tuck, and just getting the rest of the definition elsewhere.
Look at her back. Her back looks great now.
Yes, I mean, look, this is just 1 day post-op. She's a little swollen, but all these areas are gonna really contour and tighten in. So her arms also were done, and that also has some swelling, and that, once it goes down, will be a lot more defined.
What treatment are we doing right now for her?
We're doing a lymphatic massage, which she was lying down for previously, and she's doing the aftercare, hyperbaric, IV therapy, which is really gonna help those fluids move out.
Now, what makes this a spiral thigh lift?
So the spiral thigh lift is really just taking 2 dimensions and taking more of a circumferential approach. She had the spiral because it's literally a spiral line that goes in between her leg and kind of naturally pulls everything, allows the surgeon to do that. The liposuction portion allows for the skin tightening, Renuvion, to really help tighten the skin. It essentially shrink wraps it to the new shape of her leg. As you can see before, she had a lot of laxity here, and you know, that's a lot of the cellulite, even naturally in the skin, that gets pulled. Now it's completely smooth. I mean, look at that. It literally looks like she's 20 years old again. There's no fat here. It's all definition and all smooth. Again, with this, it pulls everything in. Instead of taking a 2-dimensional approach, it's really taking in more of a multifaceted removal of the skin.
Can we show them the spiral from the front?
Yes, we can. We'll have our patient slowly turn around. Either way. And you can really get to see the results here. So again, this is her from the front. This is the continuation of that spiral lift to the front, allowing the contour of her leg to continue to show that tightening and definition, which over time is going to really go down. The swelling will go down and the skin tightening will further tighten. And she can also do things like radio frequency to even get more tightening. But her results are phenomenal. She's going to heal very well, and you can see how small the scar is, and once it's lighter, just like her skin tone, you won't even notice it, you guys. This is amazing results, just 1 day post-op. So just check in with us, and you'll check her journey on her next surgery, and you'll see what the continuation of this and the results that are really going to come out on the rest of her body on the upper portion. So stay tuned. Thank you guys for coming in. Not coming in, but tuning in, but okay.